Yes.
Well, then, yes, congratulations.
Yes.
We all hope you did get someday. Does it feel good?
You can't, yeah, I don't know yet, right? This is day 4, really.
Yeah. Like,
Yeah. Like being out working.
Yeah.
We need somebody with
Hope you enjoy it. Okay, I think we'll probably go ahead. We have a quorum and it's 6:30. So I'm gonna go ahead, everybody. Happy New Year. I'm gonna call the meeting to order. And we have the wonderful Connie as our virtual attendee. If everybody give her a wave. And I'll try to remember that you're there because I'm learning all this from my friend's meeting. So first we need to have for the consent agenda and the minutes from the last meeting. To see if anybody has any discussion or questions or anything, including you, Connie.
Nope.
Okay, and I'm already realizing I forgot something, so I'm gonna pause and say I apologize. I did not give our guests a chance to say hello or introduce yourself or.
And you're totally fine. I'm Jody Carval and I'm representing Sugar Creek. But I learned that I'm really not supposed to be here.
I'm happy to hear.
Hey, Ben.
Please don't feel that you're unwelcome.
I just thought I'm already here and I'll just listen in.
Sure. Well, welcome.
Thank you.
Okay. All right. So now back to the consent agenda adoption and the minutes from last meeting in December. It doesn't seem like there's any discussion. So does anyone want to motion or?
So moved.
Thank you. Second?
Second.
Okay, thank you. All those in favor say aye.
Aye.
All opposed?
Aye.
Okay. That's good. I'm assuming that's for in favor. Is that correct? Okay, thank you. All right, so motion is passed. Next up, we're gonna have one of our presentations to meet the Ohio Revised Code requirement that we have the annual completion of continuing education. And should I read this whole thing?
No, you can just.
Okay. Okay, so tonight's presentation will be presented via video. It's from Kent State. They've actually developed several of these. And tonight's presentation is entitled Introducing the Foundational Public Health Services Model.
Is that loud enough for everyone?
A little louder.
I got math histories.
Yeah.
Move this. Video.
Can everybody hear all right? Okay.
So I wonder where all this stands now.
Yeah, I just wrote equity is the North Star. I hope so. That's what I said. Anybody else have any thought about that after that? Sounds like a fun loss from the top for me, but.
I think Nancy should take credit for some of that because this
Yeah.
was really while you were president, right?
Yeah.
They developed this series.
Yeah.
Thank you, Nancy.
Okay, so next, we're gonna turn it over to Noah for the series of monthly, finance reports. Plus, I guess the last one is the extra this month.
Resolution.
Yeah.
Yep.
Okay. Thanks.
So it should be pretty easy tonight, no confusing percentages or anything like that, because we're reviewing a year in totality, so 100% is 100%. So revenue at the top, as always. So now is when you can look at these grayed out columns kind of in the middle-ish, and you saw what we estimated those percentages of our total revenue to be for each one of those funds. And now you can look at those and see how close we were to that revenue breakdown. Also, when you get all the way over to the right, you can use that 100% again tonight and look at it and see, did we hit 100% or did we not for the year? So no more seasonality do we have to really take into consideration tonight. So that's why it should be a lot easier to talk about this. So just looking at the general fund, since that is the fund that accounts for most of our money, we brought in 112%, and that was 5% more than we did last year. So not only did we meet what we anticipated to bring in and more for this year, we exceeded last year by 5%. Our second largest fund is the third one from the top. That's Clinical Health Services Fund. That accounts for about 14% of our anticipated revenue for this year. And we brought in 111% of what we estimated to bring in. So we brought in, more than we anticipated again for this year. You can then go down the column and look at the rest of them, and they start to get smaller and smaller in terms of their proportional size of our total revenue after that. But those are the ones we like to focus on. And then overall for the year, we brought in 129% of what we estimated we would bring in. So it's never a bad thing when you bring in more money than what you project. So overall revenue, pretty good standing. Any questions about the revenue section? So just moving down, same methodology. We're going to look at the expenses and we're going to use the same thing. We want to be at 100% or less, ideally. Ideally, we'd like to spend more when we budget conservatively. We want to bring in, we want to spend less than what we budgeted for. So if we look at the general fund, that accounted for 42% of our yearly expenses. Not only is our biggest revenue producer, it's our biggest expense. So we spent 95% of what we thought we were going to spend. So we came in under 100% there. And then our second largest fund, again, being Clinical Health Services, that was 18% of our total expenditures this year was that fund. And we spent 88% of what we had budgeted for the year. So again, under that 100% threshold. In totality for the organization, we spent 91% of what we anticipated. So right around what we thought we were going to spend, but a little less. So we brought in more than we thought, and we spent it a little less than we thought. So both of those are good trends to have. Moving all the way over to the right and down in that lower right-hand corner, you'll just have the final operating ratios for all the funds and what their cash balances were ending for the year. They all had cash targets. And then it's what that target was plus or minus. So we get a variance. Did we bring in more than that cash target did we end with, or were we a little under? And those are based off of our cash reserve policy. But if we just look at how efficient these funds were, that's that second column from the right. And the target there is 100% or less. 100% means for every dollar that came into that fund, $1 went out. And that's about what you would expect for our type of work. So we look at the general fund, and that was right at 99%. So it's pretty much perfect. You can see a handful of them are over that 100%, and that's to be expected. As we've established before, not every program here can cover its costs. That's why we receive property tax dollars. So it would not be uncommon to see some of those funds not cover their costs. And also if they're grants, that would also mean due to timing of funding coming in with grant years overlapping fiscal years, we may not have gotten all the money yet. But obviously we're spending the money to do the work now and then we get reimbursed on the back end. But overall for the year, we had a 96% operating ratio. So that means we surplused just a little bit for the year, which, you know, is a good thing. Got to have that cash in reserve to be nimble to things that. Any questions over the income expenditure report? Next report is your voucher summary. And remember, it has that cover sheet on it now, so you don't have to leaf through all of those individual transactions if you don't want to, but feel free to do that. But what you get on the cover sheet is the budget that was set aside for each of these expense lines for the year, what the expenses were for the month for each one of those lines, and then what each expense category ended with for the year. So you get that 2025 year-to-date expense category. And then all the way over to the far right column, you just get the percentage of budget we expended for the year. If you want to just go all the way down to the bottom and just skip the finite details, you can see down there. So obviously we're excluding personnel with this. So you're looking at non-personnel expenses. We spent 87% of our non-personnel budget.
Have a nice part of this cover.
Tried to make it a lot more readable and a lot simpler to kind of discuss. But again, feel free to leaf through it. And if you have transactional questions, I'll be happy to ask them. But we tried to make this easier with the cover sheet. Any questions over the voucher summary? All right. Your last report, I'm going to apologize for this because this is reflective of the last month of appropriations. So not only do you have a full front, you have half of the back. So this is us moving money to meet year-end obligations. So as you can see, when we get to the end of the year, we borrow for basically every line available that we didn't spend all of the budget appropriated for the year to pay any remaining bills. So you can see a whole host of them on there that again, it goes on to the back. And that is us just moving money around to meet end of year obligations. So we're just taking budget from other lines. Any questions about moving any of the money? Those are 3 reports.
So then do we need to vote on these 3 and then the other resolutions? Or how does that?
Yeah, I would probably vote on the reports and do the resolution separately.
Okay. So we have a motion for the standard monthly reports and a budget.
Second.
So all in favor, say aye. Aye. Any opposed? Motion passes. And then, the next, do you want to explain this?
Every year, first meeting of the month, we always ask the board to pass this resolution to allow movement of money, which was that salmon colored sheet you just saw between meetings. So basically, there's just a section of ORC that allows you to pass that authority on to Melissa to move money between meetings. So we just ask you to pass that resolution again.
So moved.
So, Board Vice President Timothy Root moves for the approval to authorize health commissioner transfer fund from one item appropriations to another item, or any item, create new items, make additional appropriations, or reduce total appropriations. That's for Ohio Revised Code 3709.38.
Standing.
Then everyone, all in favor, say aye.
Aye.
All, any opposed? Okay, thank you. And then do you want to, is there any information you want to bring up regarding or paperwork procedure?
Sure.
Okay.
It should be done now or in new business, but we might as well just do it now. So one of the things that we as an organization have been working on has been paper reduction. I mean, this isn't new, something we've been working on for a while. Olivia and I have been discussing this for probably the last 6 months. Just about, it started with Notion that you guys have been familiar with now, where you can access all of these documents. Just how do we start to integrate that more moving forward to actually reduce the fact that she's printing off all of these copies of these packets every month for the board. So we were talking about purchasing tablets for all of the board members to have. You would not be responsible for taking the tablets with you or maintaining them. They would stay here, but they would be placed at your seats and they would already be loaded with Notion on it and have access to all the material for that night's board meeting. That way, we would eliminate the constant printing off of all these packets of paper. Not only is it saving paper, it's also saving money to not print all of these things off. We would certainly print off anything that you would prefer to still be printed off. That giant finance report is one. But a lot of the other individual documents that are already on Notion, we feel like it makes a lot of sense that it could just stay on Notion and you could follow along and access via your tablet that we would have. And then we would try and utilize the 3 big screens a little bit more in terms of having the documents that are being discussed on the screens as well. Again, it's just trying to become less paper dependent and save some money that way, save some trees. So we talked about it with Sylvia when we had some time before the meeting started, and we just thought it might be a good thing to bring up now and kind of get the board's temperature on it before we just like fully implement it and you come in and there's no paper. So
We tried 2 years ago to get rid of everything, and when that was back when we were still being mailed packets at home.
Yeah,
And you get these thick packets at home, and
then there were the emails, but still pretty much the same amount of paper.
Yeah.
And yeah.
so I'm all for it. I mean, I look at all the documents online anyway before I come. And I usually bring my iPad, so. I mean, what's the cost of providing the tablets? And, how would they be used other than once a month?
Yep. So one of the other, they would be used otherwise. So typically what we did have, and we utilized them when the pandemic happened, is we had these reserve tablets that were emergency response tablets and ended up being used for a lot of functionality during that for registration, stuff like that. These tablets would become the replacements for our emergency response technology. Because they would be up to date and they would be used in exercises that we do as an organization throughout the year. Any trainings that we do, we would use these tablets with staff and with other organizations that come in for trainings. So the idea would be they wouldn't just be sitting on the shelf for that once a month. Yeah. The cost, they are iPads, and then buying the attachment, they're not cheap. There is several $1,000s to do that, but at the same time, our other emergency response gear is out of date, and that grant is flat funded. So there's not really any money in there to purchase any emergency response equipment out of there. It basically just pays to cover our emergency response coordinator at this point. So updating our infrastructure by also being able to have you guys take advantage of technology, we thought we might kill 2 birds with 1 stone with that investment.
It's like a plan to me.
All right, I'm gonna be the bad guy and ask, what is the cost of printing out the stuff in paper every month?
Well, it's not going to be the cost of the iPads. You're 100% right there. It's just, it is a lot of paper that's getting printed off. It takes Olivia's staff time to have to set aside all these packets, and then just end up ultimately putting them in the trash. So it was more of a way just to save that. It's going to take
How many hours? Like that is?
I don't know how much hours you're spending to it. But to see your return on investment, it's going to take years.
Okay, all right.
I mean, if that's the simple question, you're not going to see your ROI in a year just off of saving paper and just off of her time. But if we're talking about multi-use function. You're gonna get your use out of it from staff trainings, exercises, tabletops and stuff like that.
All right.
Good questions, all of them. I mean, anyone who has questions, that's kind of why we wanted to
For sure.
put it out. You good, Connie?
Yep, I mean, when I came when I was new, I was surprised that this was done, because I would get it, sent to my email, so then I was like, okay, like, I'm responsible to either print it out myself or something, I didn't know. And so, yeah, I think it's probably time to go to that step then.
Well, thank you all for your feedback. And if anybody prefers to have anything in paper, please reach out to Olivia. We'll make sure you still have hard copy of whatever you want to see. And like I said, big things like that finance report, we will not bring a hard copy just for readability purposes.
Thanks very much. So I don't believe that there have been any budget meetings in the last month. I know we did performance evaluation, governance, and planning and finance. Okay. New business? Do we have any new business? Don't think so. So now additional business. Just want to cover the fact that Greene County Public Health, solid and infectious waste program, and the construction and demolition debris programs have both been approved by the Ohio EPA. So that's another exciting accomplishment. Everyone give props to that. Anybody want to say anything about that or ask anything about that? Good. Okay. After that, I would love you to search in the back of your packet. And please, before leaving tonight, read and sign the conflict of interest and confidentiality agreement forms that have been provided. Olivia will be happy to collect those before you leave. And any questions about that? Yeah, we do that once a year.
I'm assuming it's changed within the documents.
Good question. We'll sneak something in on.
Just wanted to make sure there wasn't a Snicker bar.
And then, want to ask Sheriff if he has anything he would like to share. Please.
Oh, I'm sorry.
I don't want to interrupt your meeting.
No.
Your turn.
So as you know, I'm sure all of you know now, we are facing a very robust viral season. When you compare where we are this year compared to previous years and previous times in the flu activity, consistently it's reported that we are going to be the most active flu season, it appears, in the last 25 to 30 years. Out of the 50 states, 45 states, including Ohio, are considered to be very high flu activity. Unfortunately, as I think all of you know as well, we had the distinction of having the first pediatric flu death in the state of Ohio occur here in Greene County in Beaver Creek. And so that's brought the reality very, very close to home. We're seeing a lot of flu activity in the office, in all of our offices. And it's reported that somewhere around 12% of all patient visits right now are flu related.
Mm-hmm.
So these are unprecedented types of numbers. Like I said, the highest that they've been in the last 30 years. At the same time, it's interesting that, and we talked last month, that our national leaders are revisiting vaccination schedules. We talked last month, and that's actually what I was looking at, what we talked about last month. But last month, we talked about the recommendation was to remove hepatitis B vaccine, which is a 3-step vaccine, off the vaccine schedule, and they did that. Just Monday, they approved removing the flu vaccine, rotavirus, meningitis, and hepatitis A from the recommended vaccinations, required vaccinations for children. So it's really kind of a very interesting time, no matter what your political slant is. last year, we had the highest rate of pediatric flu deaths that we'd seen in quite some time. About 300 children died last year in the flu season. We're looking at so far this year, the busiest or most active flu season that we've seen. And at the same time, recommendation is to remove flu vaccine from recommended vaccines for healthy children. So it's interesting, to see that playing out. But on a positive note, I've had more interest in the flu vaccine over the last week than I've seen in a long, long time. And normally this time of year into January, people are forgotten about the flu vaccine. I mean, it's not a topic of discussion. And over the last few weeks, and especially over the last 1 week, at least in Greene County, Ohio, I've had patients that are open to the flu vaccine and that are talking about it, asking about it, and patients that we are giving it to that have never taken it up to this point. I've never taken the flu vaccine, but this year I think I will. I think it's a good idea. Supplies so far have been good. I know our offices are all still well supplied. And normally this time of year, it's like I said, normally this time of year, the flu ship has sailed in terms of vaccines. We don't spend a lot, but we've been ordering the vaccine all along and we still have it. So it has not peaked yet, and no one knows for sure. They're talking about sometime in the next 4 to 6 weeks, we should see it peak and start to come down. Yeah.
That's great now.
Yeah. So anyway, that's the latest update on the flu vaccine. Kind of another interesting thing that's women's health related that came out this week that caught my eye was the availability of home diagnostic tests for HPV, human papillomavirus, for women. And it's a vaginal swab that is very accurate in detecting HPV. Virtually all cervical cancer comes from HPV, human papillomavirus, and there is a vaccine for it. And the hope is that eventually it will be eradicated utilizing the vaccine. However, it's still a public health issue and problem. And now there's a way to screen and detect at home. If a patient or an individual does the screening and it comes back positive for HPV, that certainly does not mean that they have cervical cancer or that they're doomed to get cervical cancer. But what it does mean is that they are at a high risk and that they do need further evaluation and further monitoring. So I thought that was a positive breakthrough. They say the test will be covered by all insurance companies and that it will be very much available for individuals. Right now, it does require a prescription. I anticipate that down the road, probably shortly, it'll be approved where they can just be obtained without a prescription. So I think those are two of the bigger developments over the last several weeks. Yes, sir.
An odd question, maybe Dr. Sherritt, but is that vaccine available for men to keep from passing it?
It is. And so human papillomavirus, when the vaccine first came out, it was exclusively for females. Well, what has developed over the last, I don't know, half a dozen years or so, over the last 5 years, is that they now find that most oral cancers in males are also due to human papillomavirus. So now the same recommendations for females are for males, not to prevent cervical cancer, but to prevent oral cancers.
What about the Ohio measles outbreak?
So, that had kind of faded and it actually had been declared, Dr. Vanderhoff, at some point, I think it was back in the late summer, early fall, August, September, had declared, no more measles in the state of Ohio. Since then, we've had some sporadic outbreaks, and it's been something that, again, people thought that it would, that ship had sailed, and it's not at the levels that it was at some point. Now, to be clear, Ohio never had a huge outbreak. I think we had 7 or 8 cases up in Knox County or somewhere. But it has not went away, and it's still active. And we have had a few cases in Ohio, which has been a surprise.
Yeah, well, I thought I saw in the news earlier today where they were calling it an outbreak because there's 3 cases in Cuyahoga County.
Right.
And then it's three children in the same family, unvaccinated, and they're quarantining. But they called it an outbreak.
Yeah, I think it meets the criteria for an outbreak. And we'd have to get the crew here to tell us exactly what that is, but it's not a lot of cases. I think it's more than 2 cases. Yeah, 2 cases. And the reason for that is in part, measles is highly contagious, more contagious than the flu. You know, you have somebody in a room like this with measles and they sneeze, the potential is for everybody to get infected. I mean, it's that contagious. And so that's what the concern is now. The reality is virtually every case of measles is in an unvaccinated individual. The vaccine is highly effective for measles, probably more effective than any of the other vaccines.
But we need herd immunity to be about 95%, meaning 95% of people are taking the vaccine, and we're about 90%.
I was gonna say it's down to 90 now, isn't
Yeah,
it?
there is a window of opportunity for measles outbreaks to occur, and that's what we do every day, watching for this. Clinical folks do that too. Sometimes the first call we get is from, an astute practitioner who's picking up the phone saying, I think I have a case, but you're right. It's like an R factor of 1 to 18. So it's super fast spreader, more than COVID even. So, and it can be very serious. In a number of children even, so.
Well, then they're vaccinated people of a certain age, as we discussed, I think, several months ago, who weren't sure if their certain age means they should probably just get.
I'm one of
them.
them.
I think I'm in that, but yeah, I know I was vaccinated, but if you check the years and what was going on, I maybe not in the right range.
The challenge for clinicians, Angie can relate to this too, and others, is that birds of a feather flock together. And in these viral seasons, and somebody comes in and they got a fever and they got a rash and they got a runny nose and they got a cough, we're seeing hand, foot, and mouth disease, and we're seeing, influenza and COVID and RSV and norovirus, which that's an easier one, but a bunch of, that's all the pukes. But anyway, having said that, it's a challenge. And when you've got 40 people on your schedule that are sick, the reality is that it takes a lot to stop and say, hey, I think I might have a case of measles here. It's easier to say, you got a virus and we're going to swab you for influenza and COVID and RSV. And if you don't have that, then I don't know what you got, but it's a virus and you'll get over it. You know what I mean? And so, it's easy to miss some of those cases.
So for the health district, I just wanted to lay out for all of you maybe a little bit of the lay of the land, what we're going to do this year when you attend the meeting. Probably right out of the gate, Five Rivers looks like they're pretty close to move out. So if you've been over on 2nd Street over there by Burger King, you're going to see their new facility, which is almost done. So within the next couple of months, we expect them to vacate the lower west side of the building here. And at that time, Jen and her team will do some remodeling, probably some paint, some fixing of wall patching and all of that. But Jen and her team will be moving downstairs. So that's home visiting, early intervention, WIC. A lot of them are in and out of the building quite a bit, doing home visits and different things. And then that will vacate some space upstairs. Beyond that, as far as programmatically, the things that we'll be doing, the same things that you see every year. But with the addition of doing the community health assessment, the community health improvement plan, the strategic plan, updating the marketing plan, the workforce development plan, all of that stuff will occur for us in this year. So your participation is critical because when we receive the data and the information back, it's really not just for me to make decisions about this. It's for all of you to make decisions about what you want your health department to look like and what avenues you want us to pursue. So I had that as an update. One other thing I wanted to make you aware of is previously we had told you that we had lost the funding in tobacco funding for the year. And that last year I think was about $109,000 or $10,000. But we did just receive notice over the break that we will have $40,000 restored from the state through contract services. So we will be funded now to do tobacco. We didn't just stop doing tobacco because you can't. But we were very focused on, the prevention of vaping in children, which is an ongoing issue, and continue that work, policy work, getting people to adopt kind of support for the 21, making sure that they're not selling to underage and things like that. So we're excited to do that. But other than that, please try and be here this year. We love being able to talk to all of you, and we hope that you share the excitement that we have about the work that we do in making our community healthier. So, and I wanted to say thank you to Jody for attending tonight. It's always nice to have one of our township trustees attend. And it wasn't that she found that, unless Tiffany told you differently, that it was the wrong one. Township trustees can always come to these meetings, and we come to your meeting too. I thought, and maybe they assigned her to the district advisory council meeting, and not just board meetings, but you're welcome to attend too, so.
Thank you. Yeah.
Thank you, everyone.
Thank you for the update. Good news about getting some more money in for the tobacco that you're gonna keep doing anyway. It's always nice. Anybody else have anything good for the order? You good, Tony? All right, so I think then we are adjourned. Thanks very much, everybody. Thank you. Bye, guys. Please turn in your forms. Good one. Thank you.